Today, we're going to talk about something huge. It's how artificial intelligence is stepping out of the headlines and into the real world to fight one of our biggest battles, cancer. We're going to dive into how it's changing, well, pretty much everything, from the lab bench all the way to the bedside. So, let's just start with a really powerful idea. What if an AI could just look at your routine lab work, the stuff you get done all the time, and predict which cancer treatment would work best for you? And look, this isn't some far-off sci-fi dream. This is the real promise of the revolution we're looking at today. But before we can really get to the incredible solutions, we first have to wrap our heads around the enormous problem that doctors and researchers are facing. It really comes down to two big things: a literal mountain of messy, overwhelming data, and a shockingly high rate of failure. And when I say high failure rate, I mean it's staggering. Just look at this number, 90%. That's the failure rate for new cancer drugs once they enter clinical trials. Let that sink in for a second. 9 out of every 10 promising new drugs, they never actually make it to patients. And that 90% failure rate, it has these massive, massive consequences. Every single attempt to bring a new drug to market can take more than a decade and cost billions of dollars. This incredible inefficiency isn't just about money. It's about time that patients simply don't have. So a big part of the problem is the data itself. On one side, you have what's called structured data. It's neat, it's organized, super easy for a computer to search. But the real story, the clinical gold, is buried on the other side, in the unstructured notes from your doctor. This is where all the crucial context lives. But trying to analyze it across thousands of patients, it's been practically impossible. So how in the world do you unlock all that valuable information? Well, this is where AI steps in. It's having its first huge impact by doing exactly this, turning all those messy notes into clean, powerful data that researchers can actually use. And the tool for the job is a large language model. You've probably heard it called an LLM. The best way to think about it here is like a tireless, super-powered research assistant. It can read and understand millions of pages of doctors' notes and pull out exactly what you need with incredible speed. It just doesn't get tired. Okay, so here's a look at how it actually works. This is an automated AI pipeline. First, the system grabs a messy, unstructured report, say from a radiology scan. Then it sends that report to an LLM and asks it a very specific question, like what is the prostate volume? The LLM reads the text, finds the answer, and shoots it back in a perfectly neat structured format that gets added right to a research database. And the result of all this? Well, just look at this difference in speed. It's kind of mind-blowing. What would take a human researcher hours, maybe even days of careful manual work, the AI does in 8.9 seconds. That's not just a little faster, it's a complete game changer for how research gets done. The researchers who built this system said it best. This isn't just about speeding up the work we're already doing, it's about making entirely new types of studies possible. Studies that were just too big, too expensive, or too time-consuming to even think about before. Okay, so AI is amazing at cleaning up and structuring data. Awesome. But now what? What can we actually do with it? Well, this brings us to one of the holy grails of cancer care, predicting how a patient will respond to a treatment. In other words, finding the right drug for the right person at the right time. Because at the end of the day, it all comes down to a question like this. For a patient sitting in a doctor's office, this is everything. Immunotherapy can be a miracle drug, but it's also a tough regimen. So knowing ahead of time if it's actually likely to work is absolutely critical. And here's why that prediction is so vital. The tough reality is, for all its power, immunotherapy only works for a minority of patients. We're talking maybe 25% on a good day. For the other 75%, it just doesn't work. We desperately need a way to find that 25% up front. And this is where new AI models like one called LORIS come in. And what's so amazing is the data they use. It's not from some futuristic, crazy expensive scan. LORIS uses information that's mostly already there, from routine blood tests and the patient's chart, things like albumin levels, inflammation markers. It combines these simple, everyday inputs to make an incredibly powerful prediction. So let's just compare the old way versus the new way. For years, doctors relied on single biological clues, or biomarkers. But honestly, their accuracy was pretty limited. It was like trying to solve a puzzle with just one piece. These new AI models, on the other hand, can look at dozens of data points all at once, reaching accuracy levels as high as 81%. That gives doctors a much, much clearer picture. But AI's impact doesn't stop with helping patients who are already sick. It's also going way, way upstream to revolutionize how we even find and develop new cancer drugs in the first place. I mean, just look at this timeline. The traditional path, from finding a target to getting a drug approved, takes over a decade. A decade. Now look at what companies are doing with AI. They're identifying a promising new drug candidate in under 18 months. It's just a radical compression of the whole process. So how does it do that? Well, in a few key ways. The AI sifts through enormous biological datasets to find new drug targets humans would never spot. Then it can actually design and test new drug molecules right inside a computer, in silico, before anyone even touches a test tube. It can predict side effects, and it can even help find the perfect patients for clinical trials, making the whole process smarter and faster. Now, I know this all sounds almost too good to be true. And, it's not a magic bullet. Getting these amazing tools from a research paper into your local doctor's office, that's a whole other challenge. There are still some pretty significant hurdles to overcome. And there are a few big ones. First, the data has to be good. You know the saying, garbage in, garbage out. Then there's the black box problem. If doctors can't understand why an AI is making a certain recommendation, they're not going to trust it. There's also bias. An AI trained on data from one group of people might not work for another. And finally, these tools have to be proven to work in the real world and get the green light from regulators. But the good news is, brilliant people are already working on solutions. One of the most exciting ideas is called federated learning. It's a really clever way to train a single, powerful AI model using data from lots of different hospitals. But, and this is the key part, without any of that sensitive patient data ever leaving the hospital. This helps build smarter, less biased models, all while protecting privacy. So, we end with this thought. The potential for AI to save lives in the fight against cancer is just immense. But it also brings us to a really fundamental question. How do we, as a society, as doctors, as patients, build trust in a life-saving technology whose inner workings we might not ever fully understand? The journey to answering that, well, that's going to shape the future of medicine.